to thank everyone for being here for the second public meeting of the Joint Conference Committee on Mental Hygiene. I would like to thank my co-chair from the Assembly, Assemblywoman Gunther. And I would also like to introduce the Senate members who are up here at the dais. We have Senator George Amador, Senator David Carlucci to my immediate right, and the filling in for the, or I guess the ranking member here today, Senator Dilan. So thank you for being here. For the record, Gloria Pham is the recording secretary for the Senate for the Joint Conference Subcommittee. At this time, I would introduce Assemblywoman Gunther to introduce her side of the dais.
Good afternoon and welcome to the second meeting of the Mental Hygiene Conference Committee. At this time, I'd like to introduce the Conference Committee and the Assembly. We have Assembly Member Rosenthal, Assembly Member Jaffe, Assemblywoman Richardson, Assemblyman Hawley, and also Assemblywoman Joanne Simon. And Alexis Conti, excuse me, is our secretary.
Thank you, Assemblywoman. I would like to thank Assemblywoman Gunther, since our last joint conference, members and their respective staffs had been meeting, and I am encouraged by their hard work and the efforts they have made. We now have a table target of $15 million, and while I think I speak for everyone up here, I am disappointed with that number. I can tell you that there are efforts continuing to be made from an advocacy standpoint in the general discussions in the context of the budget to see if we can't bring additional resources to the table for this for the people that we're serving. We are moving forward in issues important to the Senate and the Assembly, such as heroin, veterans' mental health, sheltered workshops, respite care, crisis intervention teams, and other longstanding concerns that are voiced by those before us. At this point, I would ask if there's anyone, or actually I'll turn it back over to someone, Gunther, for a statement, and then we'll turn it over to any members at the dais who would like to say a few words.
So still, we're also disappointed with $15 million, and we hope there'll be more money added, but I don't think there will be, because this, both the alcoholism and mental health and DD committees and population really need a larger infusion of money in order to take care of their fragile needs. As far as we don't have a three-way agreement on Article 7 language proposed by the Assembly, Senate, and the Executive, negotiations will continue to move in a positive direction. Sorry. I still have a big mouth anyway, so. Assembly priorities are housing for people with DD and also mental health, crisis intervention teams, treatment, and also treatment for heroin abuse. So there is a lot more to do in this committee. I want to take a moment to thank all of those who shared insight, knowledge, and experience in regards to the needs of behavioral health and developmental disabilities community and the state fiscal year budget 2016 and 27. Before we conclude this meeting, I would like to give my colleagues an opportunity to speak on the budget negotiations as well. Linda Rosenthal.
Okay, does it work? No? That is it. Okay, sorry about that. As chair of the Assembly Committee on Alcoholism and Drug Abuse, these numbers are beyond disappointing because, as all of us know, there is a heroin and opioid epidemic in the state, as there is across the country, and we need additional funding to address the epidemic, to address other substance use disorders, to provide prevention, education, treatment, recovery services. There's so much that is needed in this area, and we will do our best to try to locate more funding. We're still dedicated to doing everything we can to fight this epidemic and provide resources to vulnerable people who need much, much more comprehensive care than they're getting right now. And I look forward to working on that. Thank you.
Assemblywoman Jaffe.
I too have concerns about the allocation that is being recommended in terms of the $15 million, given the serious needs of our communities, for our youth, for our adults, for the issues that just were mentioned regarding serious concerns in terms of people with developmental disabilities, as well as those who are enormous numbers with drug addiction. This is a growing situation and serious situation in our state and many of our communities. I believe that we need to increase that funding to provide treatment. Even our youth, very, very early ages, who have serious mental health issues need to be assured that they have counseling and programs that would provide assistance for them and their families as well. I think perhaps we should move some funds from the Justice Center into programs that will actually provide assistance to our communities, and that is something I'm going to recommend. As we move forward, we need to assure that the funding is available for this very serious concern regarding mental health, developmental disabilities, and drug addiction. If we are going to allow families to be stable, to provide our youth with a future that we all feel is essential in terms of their stability, we need to provide the funds to assure the programs are in place for them. Thank you.
Assemblywoman Simon.
It's not on now? Okay. Yep. Technology. So I wanted to just add my support for the request for additional funds. This $15 million is more than a 20% cut from last year, and I don't see how the needs have not gotten smaller and the costs have gone up. I'm particularly concerned, as are my colleagues, with regard to the developmental disabilities population, and particularly with regard to those people with developmental disabilities who are adults and whose aging parents take care of them in their homes, and the tremendous need for respite care services and the like. And so I will be fighting very hard to ensure that we have more funds to dedicate to these services. Thank you.
Senator George Amador.
Chairman and Chairwoman, I just want to express my displeasure and disbelief that we are talking about $146+ billion state budget. And at the table here in this committee, subcommittee, we're only talking about a $15 million increase or a difference. When we talk about the quality of life in the state of New York, the people that this subcommittee or this table affects are the most vulnerable in our communities. To the workforce, to the care providers, to the individuals who provide prevention, treatment, recovery services, those agencies, or the possibility of increasing housing, transitional housing, supportive housing for our residents in the state of New York is in grave danger because of the lack of funding. When I know that there's plenty of funding in this budget that should be dedicated and directed to the ones who need it the most, and it's at this table. Individuals with disabilities and individuals with substance addictions and abuse that they need help to overcome. So Chairman, Chairwoman, I hope that we are able to push back, fight hard, and see if there's more appropriation so that we can properly help and serve the most vulnerable in our communities. Thank you.
Senator David Carlucci.
Thank you, Mr. Chairman. I want to thank my colleagues and echo what's been said here at this meeting today. We need to stay committed to work together to address the priorities that have been mentioned, and I stay committed to work with you, Chairman, and members of the committee to make sure that we allocate these resources we have available in the most appropriate places to make sure we help as many people as possible. So I look forward to working with you, Mr. Chairman, to do that. Thank you.
And last, I want to introduce the current ranker here at the dais from the Democratic side, Senator Martin DeLon.
Thank you very much. I would just like to echo the sentiments of my colleagues. I believe that this is a very important table and that the most needy within the state of New York should really be taken care of. And I hope that the governor and everyone else responsible should bring up the target number at this table. Thank you.
Seeing there's no further comments at this point, the committee is adjourned.